So we're just going to go ahead and get started here. I'd like to welcome everybody to the Shift Health and Nature webinar series. You're tuning into our episode on managing parks and recreation in a COVID-19 world. Just to give you a little bit of a, I see that there's a lag. Just to give you a little bit about a background about who I am. I'm the principal scientist for Middle Path Eco Solutions, the research director and community director for the research scholar and community director for the Ronan Institute. I'm a social ecologist by training, and with this background, I'm pleased to have taken on the role as Shift's Health and Nature webinar series host. I've been co-developing this webinar series closely with Christian Beckwith, who I'll be introducing in just a moment. I'd like to also recognize Meredith Davison. She's our marketing lead, and she's just provided so much support for this webinar series to get it off the ground and to keep it rolling. And certainly I'd like to recognize also our sponsors from the U.S. National Park Service. To give you some background about the webinar series, as I mentioned, we've been working on developing it for the past couple of months. And when we initially developed it, our intention was to bring together innovators, opinion leaders, and researchers at the forefront of the health and nature movement to help advance our understanding of the public health benefits of time outside. And the way we thought about it was we wanted it to be representing these different perspectives from different stakeholders, such as public health, conservation, land management, outdoor recreation. And the intention was to facilitate this cross-sectoral learning, to understand perspectives from different sectors, and to also contribute to this transdisciplinary advancement of the field, which is really what health and nature is a mix between, the way we conceive and think about it and also how we practice it as well. And then since then, obviously, COVID-19 has happened. And so recognizing the unique role that Shift can play in bringing our community to the discussion, and also to bring together these different voices and expertise around the topic of health and nature. So we've brought together these different, these special episodes of the webinar series to help provide some support during the COVID-19 event. And so we had a webinar on March 18th, and hopefully some of you were there. And it consisted of, we had a panel of physicians who were there to just answer questions about so many questions that we had about what can we do outside. And so today we're having a webinar series that's focused from the perspective of parks. And this is certainly a discussion I think that everyone here has been having. And so hopefully today our panel can help to answer some of these other questions. And certainly, yes, and they all are. I just got to see a question that came up that are the previous webinars available to be viewed on video? And yes, they are. We have a YouTube channel for Shift. We also have the slide decks all on Figshare. And so once this is done, I'll share the links towards the end of this webinar. And since you all registered, you're all going to get these links as well. And you can just tune into the channel and just keep an eye on there, and also download the slide deck. And there's a citation there too, if you want to reference anything that was said here in the webinar. And so with that, I'd like to turn it over to Christian Beckwith, the Executive Director of Shift. And yeah, take it from there, Christian.
Thank you, Dr. Virabangsi. Really appreciate all the help that you've lent in pulling this together. My name is Christian Beckwith. I started Shift in 2013. It's been quite an interesting journey along the way to get to this point. We began with by looking at the intersection of outdoor rec conservation and land management to figure out ways to build a stronger coalition for the protection of our public lands in some interesting times. And over the course of our evolution, we've been directed to this space of nature as medicine, Nature RX. And it was actually the former director of the National Park Service, John Jarvis, who sent us down this path in 2017. So for the past couple of years, we've been looking at this intersection of outdoor rec, conservation, land management, and public health. And last year was really a eureka moment for us when we realized that the best argument that we could make for nature was as a public health intervention strategy. And we've been pursuing that path ever since. We've actually changed our mission as an organization to reflect that. And historically, what we've done is held a gathering, a convening of folks here in Jackson every October. And this is with the Shift Summit. And so we pull together folks from our various stakeholder communities of outdoor rec, conservation, land management, and public health. And what we really like about it is the sort of cross-pollination that takes place. What we find a lot of times is that a lot of this really incredible work that's occurring around the globe is happening in isolation. It's quite fragmented. And the power really bubbles up when you've got folks working across disciplines and across sectors and coming up with some of these complementary approaches that pull in different stakeholders who typically are not working together. So every October with Shift, that's what we do. We pull people together and we build programming around the work that they're doing to really try to foster some of that complementary coalition building work. And then we have another main objective, and that is the Emerging Leaders Program. And that brings in early career leaders from around the country, from our stakeholder communities, for the same reason. Number one, to get them to work together to build an alliance that will support them in their professional development. And then to make sure that the conversations that we're having reflect the priorities, both of the next generation, but then also the demographical breadth and diversity of the country, which often can be not included in some of these conversations. So that is what we have done historically. And with the change last year with our organization to focus specifically on the advancement and promotion of nature as a public health intervention strategy, we really started focusing on two main things. One was the development of the evidence base. We know we need to have a better aggregation of the data that is out there if we are to make a scientifically sound argument for nature as a public health intervention strategy. So researchers have become a really big part of the work that we've been doing, and we're trying to support them in every way that we can. The other thing that's really remarkable to us is the opportunity that's presented with the creation of a national narrative around the public health benefits of time outside. Because what we've been hearing again and again from the folks that we're trying to help is that while we're all in and everybody's trying to sing, we're not singing from the same hymn book. And so there's not a consistent lexicon or glossary or a language to what we're trying to promote. And so that's a big part of our effort as well, is the narrative. And this is really sparked in part by John Jarvis, a conversation that I had with him a couple of months ago. And he was talking about the National Park Service Centennial and how he had to develop a lot of momentum and awareness around the centennial. He had to raise a lot of money as well, and recognize that the National Park Service was not a marketing agency. So they went out and they found one and they came up with Find Your Park. Really, for the Nature is Medicine movement, we need to come up with a Find Your Park national marketing campaign. We need an America the Beautiful. We need a Smokey the Bear as our avatar. Because if we're all speaking with the same language toward the same objectives, we're going to be a lot better positioned to achieve them. So this Health and Nature webinar series is really built to help address those two components. The researchers were a key part of helping get this Health and Nature webinar series off the ground. And with them, by bringing in these innovators and thought leaders from our various stakeholder communities to help address some of the issues that we're tackling with the series, we're also trying to help the researchers understand how they can better add to the evidence base where the gaps and needs are. And so they're a big part of the conversations that we're having here today and in all the webinar series that we're hosting. And then the other part of it is just socializing the idea that time outside is a public health intervention strategy. And of course, all of this was built out so long ago in a different world. The webinar series was born, I think, in November or December, and then the world changed. And so what we're trying to do with the webinar series is continue to be very responsive to the needs of our stakeholder groups, but everything in the world today is focused on COVID-19. And so with today's webinar, what we're trying to do is bring in 3 experts who can help us look at how we proactively manage our parks and public spaces in the midst of the pandemic. And joining us today are Catherine Nagel, and she's the Executive Director of City Parks Alliance, which is a nationwide membership organization dedicated to urban parks.
Hello.
Under her leadership, City Parks Alliance has worked with mayors to permanently fund federal legislation for environmental conservation and leverage more than $100 million to build urban parks in distressed communities. She's collaborated with practitioners and researchers to advance program and funding strategies for parks and green infrastructure, strengthen knowledge and impact of cross-sector and public-private governance models for urban parks, and inspired the formation of urban park-focused organizations globally. My wife just walked in to work with our daughter as we're trying to homeschool her in this interesting time. We're also joined by Sarah Newman, Doctor of Public Health, MCP. She's a captain in the United States Public Health Service and has dedicated more than 25 years to working in public health positions, both with the public and private sectors. Since 2015, Dr. Newman has served as the Director of the Office of Public Health with the National Park Service, where she's Principal Advisor to the NPS Director and Executive Leadership for Public Health Decisions affecting 300 million visitors in 413 parks nationwide. As OPH Director, she is the NPS Lead Public Health Policy and Management Expert, providing technical expertise to the NPS on food safety, drinking water safety, wastewater, and communicable diseases, infectious disease surveillance, outbreak response, and health promotion. Welcome, Captain Newman. And we also have Kevin Roth, PhD, who serves as the National Recreation and Park Association's Vice President of Research, Evaluation, and Technology. Kevin leads the research team in its mission to create valuable data and metrics that enhance park and recreation agency performance and make the case for increased and more stable agency funding. He guides the development of innovative in-person and online educational offerings for professionals that advance parks and recreation in their communities. He also oversees the team delivering IT and web services to the association. So welcome, Dr. Roth. This presentation is being recorded for later distribution via the Slack channel that was set up by researchers. You can find this at Shift Nature Health on Slack. And we're also distributing it through our networks and the distribution channels of our partner organizations. And as Dr. Veerapansi noted, we are especially grateful to the National Park Service for the funding that was really critical to getting this webinar series off the ground. So thank you very much for that. We ask that participants mute their microphones and turn off their video for its entirety. Following the panel discussion, there will be a 10-minute Q&A session. We may open that up to a longer Q&A session because we know that the questions are so pressing right now. You can add your questions in the Q&A section at the bottom of the screen and include your name, your title, and the organization that you represent. Dr. Veerapansi will be helping me to select the questions. And with no further ado, let's get going here. And we wanted to just start by inviting Catherine and Kevin and Sarah to tell us just a little bit more about their responsibilities and their constituents. So we'll start and we'll do this alphabetically. Catherine, what would you have us know about the work that you're doing with City Parks Alliance?
Well, thank you, Christian, and thank you to you and your colleagues at Shift for pulling this really important conversation together. I think it's an incredible moment for parks to be seen as essential civic infrastructure, and certainly your focus on the public health aspects of parks and their role in helping us to get through this crisis is never been more important. We at the City Parks Alliance are a nationwide membership network. We have park and recreation leaders from the public and nonprofit sectors. We have designers, planners, funders, business improvement districts, community development corporations, the whole array of organizations that are involved in programming, designing, and managing urban parks across the country. And it's an array of diverse groups because urban parks are very diverse, from very small pocket parks to much larger parks like here in DC, the National Park, the Rock Creek Park, which stretches more than 1,200 acres. So our work is intended to increase investment in our nation's urban parks and to have our urban parks recognized as vital national infrastructure.
And with 80% of Americans living in urban areas, that's never been more important.
Exactly.
So thank you for the work that you're doing. Captain Newman, with the National Park Service, tell us a little bit about your role.
Yeah, thank you so much, Christian and Rika. So appreciate this opportunity. And, let me just also say thank you for your leadership, your partners Ship, as you have been striving to really promote our parks and our public lands as a resource for health. This is something that our Park Service has been committed to for a while through our Healthy Parks, Healthy People program, which you mentioned John Jarvis, who brought that to us here in the Park Service, and we still promote today as a really vital part of what we do. I think some people are confused, wonder, why is somebody in a Navy uniform at the Park Service? And so I always take an opportunity before I launch off to let people know we are not the Navy. And maybe one day, and it might be this virus that does it, I'll walk down the street and someone will actually say, are you a public health service officer? Instead of, are you a Navy officer? So it's definitely given us more attention than we've ever had. And you can turn on the TV at any moment and see our US Surgeon General. So I am a member of the United States Public Health Service. It's one of our 7 uniformed services. So you should be familiar with the Army, Navy, Air Force, Marines, Coast Guard. The next 2, which you may not be as familiar with in terms of our federal uniformed service role, is the National Oceanic Atmospheric Administration, which is a uniformed federal service, as well as the United States Public Health Service, which began by our 2nd president in 1798, John Adams, as a federal service to protect, promote, and advance the health of our nation. I'm very proud to serve here. And another bit of history I think is interesting is that it was way back in about 1921 when our first director, Steve Mather, reached out to the Surgeon General at that time, Admiral Hugh Cummins, and requested that an officer of the US Public Health Service be assigned to one of our parks to assess the safety of the water, to address mosquito-borne illnesses, to inspect food. And that was the beginning of what's believed to be the oldest partnership between 2 federal agencies, and we carry that today. We currently have 63 officers assigned to the Department of Interior. 58 of those are with the National Park Service. We function in our Office of Public Health, where I'm the director, really like an internal health department. In parks, where our park managers have to make decisions, we are the ones that are there to provide them recommendations to help them ensure they're meeting their regulatory requirements for food, inspections for water, for wastewater. While there are local and health jurisdictions there, that's not their role. So it's really public health service that helps bridge that link between local health and state health departments, but also to provide those recommendations to our superintendents who have difficult decisions to make. We work daily on issues related to infectious disease. It's not something that's new to us, whether it's a norovirus outbreak on the Appalachian Trail, which is now nearly annually, or whether it's issues related to concern about rabies through bat infestations, hantavirus, plague, tularemia. So there are a myriad of concerns that come up in our parks with 300 million people coming from all over the world across our entire nation, that we're there to provide the support on. So that work is not new to us. But I will say the work we're doing now in COVID-19 is like our program on steroids. Never in the history, in my experience as an officer, have I ever faced anything so daunting. And for our park managers, anything so daunting, which is dealing with a virus that is affecting every single one of our parks and of course our entire nation. Anyway, it's a pleasure to be here and to talk to you, answer questions, and be with my esteemed colleagues, Catherine and Kevin. And thank you very much.
Thank you, Captain Newman. Thank you so much for your service, particularly in this moment in time. And Dr. Roth, what would you have us know about NRPA?
Sure. Thank you very much, first of all, to allow me to be a part of this webinar this afternoon. It's a real pleasure to be able to share what we're learning and to learn what everyone else is doing. NRPA is a nonprofit that champions the work of the hundreds of thousands of park and recreation professionals and volunteers across the United States, with more than 10,000 park and rec agencies in cities that are as large as New York and San Francisco and as small as Jackson, Wyoming, and everything in between, counties and cities and states and towns and so forth. our members represent basically the parks that probably in many cases that if people are walking to a park today, if they're still open in their community, it likely is a park that's being managed by one of our member agencies. And this is a time that represents obviously a tremendous health challenge across our nation and a health tragedy. At the same time, it does represent an opportunity for us to reemphasize the importance of parks and recreation in our communities. In some cases, people are being reintroduced to this beautiful asset that may be across the street or around the corner from their house that maybe they didn't think much about as recently as a month ago. They saw it, but maybe never made a connection. And now it's really their last possible opportunity to blow off some steam and to gain some vitamin D and sunshine and so forth during these challenging times. And it's a tremendous challenge. It also represents an opportunity that Catherine referenced a moment ago, that for us to sort of recast what parks and recreation really is to our towns and cities and states.
Thank you, Kevin. We're really excited to have you here for this fascinating conversation that we wouldn't have been having a month ago. And we wanted to start out with the opportunity to just do some level setting and figure out what the salient issues are for your constituency and what you're hearing are the greatest needs, concerns, and also, very importantly, the opportunities that you're seeing arise. And Captain Newman, what would you say from the perspective of the National Park Service in response to those questions?
Well, those are great questions. I mean, I think this is, as I said, probably one of the most challenging times our parks have faced, where one of your main missions is to share these incredible resources with the American people. And you're faced with a situation in which when people gather, they're a risk to one another. And so, you know, it's a tough, very, very difficult decision to make in terms of how you cut that balance. My role as a public health official is to provide the recommendations as accurate and as science-based and as timely as possible to our leadership, so they can balance that with policy decisions, with legal decisions that will result in good decisions that protect our employees, our concessionaires, our partners, and of course the public that come to enjoy those parks. Not easy when you have a norovirus, a new virus that we don't know everything about. And in fact, we're limited in understand about this disease. And it seems, I talk with my staff about it on a daily basis, and we feel like it's like a week that passes in one day. You know, we come to the next day, and we've been serving on an incident management team for this agency since March 9th, 12 to 14-hour days. I've had 2 days off. So please forgive me if I, look a little tired or look a little ragged. I'm not complaining, because this is what I signed up for. And I am more proud than I could ever describe to you, working not only side by side with my officers every day, but with the incredible leaders in the Park Service, all the way from the park level up to our top leadership, who really care about this. And these are difficult decisions. But it's challenging with these changing guidance that can cause confusion, that can cause frustration. We're in it together. So I think if we remember that this is something we'll look back in time and say, what did we do to advance it? How did we come together and see the positive? How did we make it a successful outcome, given all the challenges and uncertainties and complexities? This is a test for us and for our nation.
And how do we apply what we learned in this process to whatever comes next? And that's such an interesting component to this.
That's such a good question, Christian. And I think I'm so in it right now that I can't, and I talked about this with my staff the other day, and we said, we got to do a hot wash. There's so many things we could have done differently. And we thought, but we're not there yet. We're not ready to sort of, we will do that. We will do that hot wash to say, what did we learn? And I think we're very good at criticizing ourselves right now. But I'm not ready to say, you know, what we need to do next. I think we will learn that, and we will look back and have really clear lessons learned. But I think I'm too engaged in it right now to be able to articulate that in a way that I could feel assured by it, if that makes sense.
Yeah, there's a great sign that I just saw yesterday here in Jackson that said, "This too shall pass," which is true, but we just all would like to know exactly when that's going to occur.
Yeah, our director says to us, I think every other day, Director Vela, who's just been phenomenal here every day and just dedicated to this with tremendous energy and care. He says, guys, we're building the ship as we sail it. Mm-hmm. And he has such understanding and compassion for the fact that we're doing, everything we can. And we make mistakes. We sometimes do or say things we regret because of that changing guidance and changing information and not always being aligned and on the same page. When you have 419 parks across the nation with local advisories, local information, CDC guidance, it can become almost impossible to have a unified voice. Mm-hmm. And that, I think, is one of our biggest challenges. And I don't know how we overcome that except to be honest about what we're doing, base our decisions on science, what's available that day, and be honest about where we made mistakes.
Yeah. Well, we do want to get right into the meat of the issue because there's just so much to discuss here. And I was wondering, Catherine, you had a webinar at the end of last month with park professionals that were focused on COVID-19. And I'm curious what you learned from the panelists about how they're managing their staff, facilities, and programming during this pandemic.
Sure. Well, I want to thank Captain Newman and her colleagues, all of the park professionals out there who are doing heroic work. The situation is changing so rapidly, but what we heard last week is that park leaders are really on the front lines of helping cities in our constituency manage the crisis. They're turning their rec centers, in many cases have been closed down for traditional recreation activities, to meet the frontline needs of their communities. In San Francisco, they've converted 35 of their rec centers into emergency child care operation centers. In Los Angeles, the rec centers have been turned into makeshift homeless shelters. New York City, Central Park, now the Great Lawn there is housing a makeshift hospital. So the assets of the parks departments are being used for these emergency services. And in addition, park leaders are having to pivot very quickly to figure out how they manage the spaces to make sure that our urban communities have access to the outdoors. If you live in an apartment where you don't have a backyard, you have small children, you need to get outside, your local park is critical for your mental and physical health. And park leaders are struggling to do the right things. They're complying, of course, with health officials, making sure that they're following the guidelines that are being handed down through their mayors and governors, but really trying to figure out how they manage people, how they make sure that people are maintaining the proper social distancing while providing an outlet so that people's sanity and physical health stays strong during this time of crisis. So every city is sort of managing it in a different way. Many cities are looking at how they can use the public realm, shutting down some parkways to vehicular traffic and figure out how they turn that over to just pedestrian or bike traffic, but really trying to be as creative and responsive as possible in a changing environment. So what we hear in summary is that these are challenging times. They're trying to make sure their staff are healthy. They're trying to do as much as they can to meet the needs of the residents of their communities.
That's great. And I want to put a pin in the creative part and come back to that in just a minute. But I also want to talk to Kevin about the inaugural Park Snapshot that NRA just put out. It had a number of fascinating observations, one of which was budgetary and the sort of impact that the pandemic is having on budgets for parks and recreation departments around the country. Kevin, what could you tell us about what you found?
Sure. So real fast, a snapshot is something we've launched in the last couple of weeks. We're doing a weekly survey of park and rec leaders across the country to ask a handful of questions of what's urgent and how they're handling the COVID-19 issues in their community. So in our most recent survey, we did ask some questions about budgets. And what we're finding is 42% of agencies, as of last Wednesday or last Thursday, when we conducted the last survey, have already said they've been asked to cut their budgets by a median of 20% for this fiscal year. And already about 20% have already been asked to look at next fiscal year and begin to cut on an average of 10%. We know this is just the beginning of what is probably going to be a massive hit on financial resources for park and rec agencies across the United States. There was a, by training, those letters after my name is actually from economics. I have a PhD in economics, and at times I still pretend to be an economist once in a while. There was a fascinating article in the Wall Street Journal this past weekend where they had commissioned an economist to look at the economies of the 50 states, of what's happened in the last month. And on average, that study found that about the GDP had fallen 30% between March 1st and April 1st. And if you begin to connect that to things such as property taxes, sales tax collection, income tax collection, and how that impacts a typical agency's funding, it's going to be disastrous. On top of it all, you see that a lot of agencies are required or expected to recover 20, 30, 40, maybe 50% of their operating budgets from fees, from registration fees for a class, to entry fee into a pool, to parking fees, sponsorships, maybe a festival. All that stuff is at this point dead in the water. And that money, even if some of those tax dollars begin to recover, those earned revenues may be very slow to bounce back in a number of communities. It's really scary to think what we're seeing already and what is potentially going to happen in the coming months and even years to follow.
Mm-hmm. Yeah, and we'll circle back on some of the opportunities. It's easy to be fixated on some of the darker sides of this pandemic, but I think there's some opportunities that we could talk about as well. I'm going to go out on a limb here and assume that most of the folks on the call consider time outside to be an essential service. And obviously we've heard a lot about essential services over the course of the past couple of weeks. And I'm curious how you're positioning your messaging to reach elected officials and convince them of the importance of time outside, particularly as a mental health intervention strategy. And Captain Newman, what is the National Park Service doing to position parks as an essential service?
Well, let me speak to public health perspective on that, because I think what's important is that we realize, of course, being outside is essential. Connecting with nature is essential to our health. There's no doubt about that. The science is building, as you said, and the evidence is mounting. And it's going to be critical for people to get outdoors and connect. In a time when we are in the largest pandemic, with death rates we've never seen before, and we're at the peak of this curve, and we see it increasing in communities throughout our country. In terms of public health, social distancing, ensuring we do whatever we can to lower this curve and not exhaust our healthcare systems, which will result in more death. Not only of those folks who have the illness, but folks who are on the road driving, get in a car accident, and have no healthcare system to serve them or are limited in their service. I mean, it's really thinking broadly about the public health implications of our continuing to sort of act normally. There are many stay-at-home orders for a reason. And it's really to help our nation get through this. So we're going to have to pull through together, lock arms, and really be serious about it. And there are tremendous ways to get out and connect. And Catherine, I can't agree with you more. Those folks who are in apartments or in places where those the only accessible place is a nearby playground, this is going to be hard. But it can be done where we can bike to where we want to go, we can walk, we can get out in our neighborhoods and connect and social distance. The concern I have as a public health official is when we have people who are on stay-at-home orders, they get in a car, they drive 2, 3, 4 hours to one of our parks, and then we have a dissension of numerous people where it makes it nearly impossible for our park managers to enforce social distancing and poses a risk not only to the public, but to those, to that workforce. So, you know, while I can't be more of an advocate, I myself love the outdoors and do whatever I can even now to get out and get a little bit of vitamin D. We have to be cognizant of the fact that we've got a pandemic that is nothing we've ever seen in 100 years.
Yeah.
So we got to balance that and really adhere to the guidance that will allow us to lower this curve and save lives in our nation. It's going to be a sacrifice.
Mm-hmm. And, you know, to that point, I think, you know, there's just so many unintended offshoots of the pandemic. And the New York Times had a very interesting piece a couple of days ago on some of the unintended consequences of COVID-19. Catherine, I'm curious, you know, one of the things they mentioned was an unintended consequence of the stay-at-home orders was an increase, among other things, in domestic violence. And you work with mayors around the country. I'm curious what you're hearing from them on the sort of unintended consequences that they're seeing with the closure of their parks, in particular as it relates to vulnerable populations, which obviously parks play a really big role in the public health of those populations. What can you tell us about that?
Well, that's a great question. We manage a Mayors for Parks Coalition, and so our staff has been in touch with mayors all over the country on a consistent basis so that we can understand what's happening on the ground. You know, we were facing a public health crisis before this crisis. 1/3 of our children are obese or overweight. You know, we spend $500 billion on managing chronic health conditions. More than 43 million US adults suffer from depression. 1 in 10 Americans, you know, we all experience stress in different ways, particularly in urban communities. And I think the most vulnerable populations in our urban communities are really experiencing this issue at a different way than many others are. You know, homes might not be safe for people to stay in. You know, even if children are able to get outside, our park assets are not equitably funded or accessible. So, you know, you might be able to get outside, but if you don't, your kids can't walk to a park, that makes it even more difficult. And if you have to get there, you know, walking through a neighborhood that's not safe, that's another challenge. I think you know, what we'll see is that the mental health benefits of urban parks are really coming into the forefront as people, you know, use this time, if they have access to parks, just to be able to walk, to clear their minds. You have a sense of reassurance. It has never been more critical. I'm an urban dweller. You know, I'm able to get out of my apartment, but I feel fortunate when so many, you know, so many of our children, I can't. And I think this really calls for greater investment in our parks across the board, but particularly in cities where these parks are critical for our very survival.
Mm-hmm. Yeah. One of the things that I wanted to bring to Kevin's attention is we've gotten a lot of questions, even, you know, during this call, but also in advance of the call. One of the most pressing seems to be regarding the possibility of reopening, you know, when the shelter-at-home restrictions are raised. And Kevin, what are you hearing related to the sorts of metrics that are going to be needed for parks and recreation departments to begin to open back up?
I think that the key thing for most agencies and most agency leaders, they're going to be listening closely to the guidance from CDC, from the local public health officials, and of course the local and state government officials that in many cases actually ordered the original closing of indoor facilities and other types of places. I think one of the things that talk about the information void already mentioned a little bit earlier in this conversation is I don't know if any of us have a true appreciation of what the ramping back up is going to be. It's not going to be a light switch. We're going to flip a light switch and everything is back up, not just for parks, but just for our society and as our economy as a whole. And it's when we talk to, when we've been talking to some of our members, conversation we had late last week, it's interesting. You see a number of park and rec leaders still planning for the potential of providing some summer programming, whether it's summer camps, whether it's opening pools, but at the same time, that may be based upon a belief that things are going to wrap up in the next 4 to 6 weeks, which may seem, politely to say, maybe a little naive at this stage, but also be the decisions about this summer and this fall, even fall programming are being made now because the inability to hire summer staff, the inability to do maintenance to pools right now is basically already making these decisions for the summer and may already begin to be making these decisions for the fall. And so it's going to be very difficult. And I seeing some of the questions here about how people are going to coordinate between even the national, state, and local park systems. That's an excellent question, but it's also kind of the groups need to get together with their leaders to discuss what does this ramp up look like. And I imagine no one can really, with a straight face, even answer that question. Dr. Newman, I imagine she'd comment about this is not going to be a light switch of issue that everything's going to be okay tomorrow and we're back to normal.
Yeah, Kevin, I think that's right. It's going to be thoughtful decision making. Just like the closures, there wasn't sort of a day when all parks closed. I mean, 75% of our parks are still accessible. I think people may be surprised to learn that. While many of the services are not available, our visitor centers, you have concessions, food, and hotel services that have shut down. In many cases, bathrooms have been shut down, and these are all being done very thoughtfully, but and painstakingly by each part using this risk assessment tool that we developed to help them carefully go through and figure out what could they do to mitigate risk and maintain operations without putting their employees and the public at risk. And when they get to a point where they've done whatever they can, reducing operations, limiting, putting barriers up, putting signs up, and just they can't control the numbers of people, then a decision, and then the local health department weighs in and says, you're a risk to our community because you're luring these people in, they're using our grocery stores, they're making very thoughtful decisions. Again, you haven't seen the NPS just stop services. It hasn't been done on a national scale. And I think that same sort of approach will be used for opening, which will be very thoughtful. I mean, we don't know if there could be another wave. So we've got to be really, again, it's a new virus. We don't know how much immunity we will have in this nation after a first wave. So we've got to be really cautious that we don't, Kevin, as you said, sort of this quick opening, and then we get ourselves in a really bad situation where we've got all these new seasonals and dormitories opening, and then we've got this wave, and then then we've got something to deal with. So I think it will be gradual, and I think it's even hard for our park managers to think about not doing what they love doing most for a long time. And I don't know what a long time is, honestly. I mean, just 30 days seems like a long time, but we're moving in now to the April and May when, who doesn't want to go to a park? So this is going to be hard.
We're getting so many good questions that are coming in. And I want to do, there's one that really grabbed me when I was looking at them yesterday. It was something that came in before this from Jeff Hester with Social Adventures LLC, and also echoed by Paul Gobster with the U.S. Forest Service. What other tools besides social distancing and outright closures can we use to keep parks accessible For example, restricting the number of people on a trail at a time, the creation of one-way trails, time zoning of use types, quotas for wilderness trails. And Catherine, I know you've got a webinar coming up on some of the creative engagement strategies that parks are using. What would you say to their questions?
Sure, so that's taking place this Thursday. We would encourage people to sign up for that webinar. You know, there's so much work that's going on in terms of virtual programming. I believe I saw that Mitch Silver is on the line in New York City. They've launched a Parks at Home online platform, which I think is very, very innovative, where they're showing people images of parks. They're holding, meditation sessions, offering art classes, and all kinds of other good things, sharing open source data. They've got a squirrel census and citywide street tree maps. So all kinds of interesting creative work that parks are where they're trying to shift their programming. Here in DC, the Rock Creek Park Conservancy has encouraged people to host an individual cleanup. And so basically they're saying, go out, take a pair of gloves, a trash bag, whatever patch of the park that you like, and help clean it up. So I think that there's some interesting ways that cities are sort of reinforcing the message that you shouldn't be too close to other people, but you can still be out there and you can do some good as well. In Memphis, they've started live streaming the sunset every Sunday evening, and even having their people who are in the parks, sort of do their own social media to show how they're practicing good social distancing. So lots of creativity out there, and again, we'll be sharing more of this. I do want to make a reference back to your earlier point, though, about equity. We assume that everybody has access to technology. And as we shift to providing more online resources, we still need to keep in mind how we're going to keep providing services to our most vulnerable populations and to those who don't have access or have limited access to technology as this becomes more of the norm.
Mm-hmm. Yeah, I think one of the things that we've been finding with this webinar series in general, and then obviously here today as well, is that folks are really looking for some guidance and some help as we try to navigate this unusual situation. And one of the questions that came in yesterday was from a fellow, John Newman, who was a river ranger in Hell's Canyon National Recreation Area on the Snake River. He says, I've been following CDC and local state guidelines, but these are changing daily. Do you have thoughts or recommendations as to when to open parks, campgrounds, boat ramps, and restrooms for the field season after the stay-at-home orders have been lifted? Do you have any insights on how we might respond to those sorts of questions?
Well, Krish, I'd say, if Tony Fauci can't predict this virus, neither can I. I don't know. I think Catherine, I so appreciate your insights on this innovation that's happening. I think one of the things that is most exciting to me, if we could see a silver lining, which is a good thing to do, right, during a time like this, is the innovation in our nation, that we're coming together as a nation to really think about how can we innovate. I mean, when I walk down my street and I'm 10 feet from a neighbor and I wave and I see this compassion and I hear about these innovative ways we're trying to cope and being positive and just having a great attitude as much as we possibly, that's going to be so critical for our mental health and our well-being. And it's a great question, John. I mean, when can we get back to normal? Mm-hmm. We all want the normal, but I think one thing we can do right now is embrace the amazing opportunity we have to look at what our nation can do and how we can get through this together. Again, we will likely never experience this again in our lifetime, we hope. But we are seeing this amazing compassion of breweries creating hand sanitizer, which when I was asked a couple of weeks ago, ma'am, can we allow our park managers to procure hand sanitizer from breweries? I thought, oh my God, this is a question I never imagined would come to me. So of course I connected with contacts I have at the FDA, asked them, are hand sanitizers produced from breweries, meeting FDA standards? And FDA has created guidance that allows for this. And you don't see this sort of rapid decision making. Now the breweries need to follow the FDA guidance to assure that we're doing the best we can to make this stuff safe. But when you run out of vital PPE, you make quick decisions. You use the science the best you can, and you get innovative. So it's amazing to me to see how our nation's coming together and doing all this innovation, finding ways to cope.
Mm-hmm. I do want to see if we can find some of those glimmers here. And Kevin, I'm just curious what you've learned so far in the pandemic that you think could be applied in the future moving forward, both to, knock on wood, we hope not to a future pandemic, but to do a better job of maintaining our parks and really elevating their essential nature in our society. What are the main takeaways that you've observed so far that will be valuable moving forward?
I think one of the first observations that we've made, that I guess I personally have made, I have the fortune or misfortune to live in a suburb that has where it's not particularly congested, so I'm able to take a walk, an hour walk, without worrying about social distancing challenges for the most part. Maybe occasionally I have to walk into the street, but the street's not congested anymore, and there's some nice parks and trails nearby. But if you're in an urbanized area with great density, the challenges we're seeing in some large cities in New York and so forth, where the parks are being heavily used, well, that's an artifact of the fact that there's actually not sufficient amount of parkland in those areas to begin with, not a sufficient amount of trail space and so forth. And that's true in everyday life, let alone what we're going through right now. And we, for years, along with CPA and other partners, have been arguing, that the need for these types of investments to be made in these communities. And whereas maybe some people were seeing that a month ago as being, wouldn't that be nice to have more parkland? We're seeing the urgency of that today. The challenges that New York and other large cities are having about overcrowding their parks, it's only going to get worse in the coming weeks and months as the weather improves. People who are living in 500, 700, 900 square foot studio apartments just don't have the luxury of me hiding on one floor of my house that some of us here have right now. They need to go outside, and the lack of sufficient open space is going to be, the challenge is already happening now, and it's only going to get worse this summer. So that's one part of it. But going back to one of my earlier comments, the demonstration of the essential nature, the essential utility of parks and recreation has been on well displayed for the last month in so many areas. And Parks and Rec has always been that low cost, no cost physical fitness opportunity for so many members of our community. And it's a chance for us to take these learnings and then take it to the future when we reach some sort of new normal, whenever that is, and to make sure that we aren't forgetting that and making sure we are making the investments we need to be making both at the public level, but also at the private level, working with public-private partnerships and nonprofits such as Catherine that Catherine works with to really ensure that our park system, our park and rec system, our trail systems are really meeting the needs of our community in the future, both in quote-unquote normal times and hopefully many years ago now from when we may have another pandemic like this.
Thank you so much. And I see Dr. V has joined us, which means that we're approaching the close of this webinar. And so we're going to turn it over to her. I would like to thank you all for joining us in this particularly interesting time with your observations. And we hope to have more of these conversations in the weeks and months to come, but hopefully not too many more weeks and months.
Thank you.
It's been a pleasure.
Great, thank you. Thank you all so much for participating in this panel. And then also to the audience, thank you so much for being here. And we're really informing, your comments and your questions are really informing the way that we are thinking about structuring the webinar series and the type of information that we can help bring to you all. And there are so many important questions that were posted here, and unfortunately we didn't have time to get to all of them, but we are going to think on a way of where we can try to create a venue where we can discuss some of these questions. So let me think on that. I just posted some links to the YouTube channel where we have the webinar recordings will all be there. We have the slide decks are all going to be on Figshare. There's a Slack community for Shift. There's the link there that I also posted here. I see that my slides are not moving. And then also we have our next webinar is on connecting people to parks in crisis, loss, and grief. And so that will occur next week. It's about the mental health and well-being, and that parks can help to support and provide. And some Shift announcements. We do have the Emerging Leaders Program, and you can talk to Morgan Green about that, and also Shift Awards. Please contact Arian with that. And so with that, I'd like to close the webinar, and thank you again so much for being here. We look forward to seeing you again on the next webinar.
Thank you.
Thank you all.
A pleasure.